Stroke. A stroke is anything that impairs circulation in or to the brain. That may be caused by thrombi, emboli, or bleeding. So we're talking clots that form in the brain, clots that travel to the brain, or bleeding within the brain. A thrombus may be atherosclerotic plaque, a buildup of atherosclerotic stuff. A thrombi and emboli may be blood clots. When we're talking about strokes, we're talking about cardiovascular accidents, but we need to compare that to transient ischemic attacks. Cardiovascular accidents, CVA, result in neuronal death. It's death of the neurons in the brain. The damage is usually permanent or very long-lasting, and it requires extensive rehabilitation. If we're calling this stroke a transient ischemic attack, a TIA, it's a brief period of inadequate perfusion. It's a sudden focal loss of neurological function, suddenly losing vision, but is an example, but full recovery usually occurs in 24 hours. So let's track the blockage, the thrombus, the emboli, or the hemorrhage. Because of them, there is a lack of circulation to some portion of the brain. Lack of circulation means no oxygen. So we have hypoxia in those cells, which develops into ischemia and inflammation. From this lack of oxygen, we're getting death to neurons in the region. But let's go back to that ischemia and inflammation. Remember our good old friend inflammation? With that, we get increased vascular permeability, fluid leaking from the blood vessels, and we get edema in the brain, swelling in the brain. And that pressure causes further blockage of the perfusion, and that too is going to cause death to the neurons. The manifestations of a stroke vary, and it depends on how bad the stroke is and what area of the brain is affected. First thing to remember is injury to the left side of the brain affects the right side of the body, and injuries on the right side of the brain affects the left side of the body. And the second thing you need to do is go back, look at the brain pathophysiology, look at the brain lobes. The functions associated with different brain lobes, remember them, because that's going to dictate the results of the stroke. Clinical manifestations. Remember, they happen quickly. There's a very abrupt onset. It's focused in one area of the brain. We may have some type of paralysis, a hemiparesis. We may have it on the right side of the body, the left side of the body, the legs, the full body, whatever. It depends on where the blood clot or the hemorrhage is. We may have total vision loss, or just certain fields of vision are lost. There's dizziness, ataxia, aphasia, and a sudden decrease in the level of consciousness. A stroke is an emergency. It needs emergency management, and it's focused on decreasing the cerebral edema and decreasing the intracranial pressure. And again, we're looking at long-term rehabilitation with a stroke.